Hello, my great friends. I'm Dr. Schultz, and thank you again for tuning in this week to my blog video. Have any of you noticed you're hearing the word pneumonia more lately? I've noticed in the last 3 months, I hear it about every week or every other week. More and more people are getting pneumonia, and I'm wondering what's going on. Well, did you know that in the last 15 years, the incidence of pneumonia, how many people are getting pneumonia, is up 3 times in the last decade and a half. And this year, it's up even dramatically more infections with pneumonia. Now, what is a pneumonia? Okay, pneumonia, the word just means an irritation or inflammation in the lungs, an infection in the lungs, an inflammation in the lungs. That's what pneumonia means. It comes from the bacteria that usually always cause pneumonia, called Streptococcus or Streptococcus pneumonia. And that was treated with antibiotics, and that may be where this problem is, because nowadays there's a huge rise in the incidence of pneumonia, not only in the last 15 years, but just this year in the hospitals, and that is because people are getting infected with other types of bacteria and other types of virus in the lungs, like E. coli bacteria now causing pneumonia. And why could this be? Well, a lot of doctors and a lot of hospitals are theorizing that it's because we used antibiotics to wipe out Streptococcus or Streptococcus pneumonia forever, for years and years and years and decades. And now we've created antibiotic-resistant strains of bacteria that are infecting our lungs and causing pneumonia, like other forms, mutated forms of Streptococcus bacteria, or even other bacteria like E. coli now. So I just want you to know, be careful out there, because the rate of pneumonia is skyrocketing and the winter season isn't over yet. Now, what are we going to do about it to prevent ourselves from getting sick? Well, the best thing you can do, my friends, is the cold and flu shot. And in this video, I'm just going to talk about one herb in the cold and flu shot, the Echinacea angustifolia root, the Echinacea purpurea seed. But Echinacea has been proven in hospitals and hospital university studies to reduce your risk of getting pneumonia and other viral and bacterial infections by 50%. I like that, 50% reduction. Now, how does it do that? It does that because it stimulates your immune system. Your entire immune system, your T cells. You know, they have many kinds of T cells. T cells that go out and kill virus and bacteria, T cells that send messages, many types of T helper, T killer, all types of T cells. It increases the amount of T cells in your body. It increases the amount of B cells in your body, and your B cells are your immune cells that create specific poisons to kill Streptococcus or whatever E. coli bacteria, virus. And they do that because they have a chemical on their surface called immunoglobulin, and they develop antibodies with that immunoglobulin to kill specific virus and to kill specific bacteria. And on top of that, Echinacea increases the amount of the immune chemicals in your body, like interferon and interleukin. And both those chemicals, when they detect Streptococcus or E. coli or any type of bacteria or virus, they emit fluids that increase the temperature of the body, which speeds up the white blood cells, and that's called leukotaxis. And that means for every degree of temperature rise in the human body, the speed at which the white blood cells can go to that infection and kill it is double. That means at 103, 104 fever, your immune system is moving at 64 times faster than normal. So remember that, my friends. We don't want to reduce the fever. Okay, look, I'm out of time. So next week, I'm going to come back to you with all the other herbs that are in the cold and flu shot and what they're going to do for you to prevent you from getting sick, but to treat you if you do get pneumonia or the cold and flu or any other type of infection. Mwah! Love you a lot. See you next week.